Results First in North Carolina got started almost by accident, you might say. I asked one of our senior appropriations chairs, how did we know for sure that the money we were budgeting, the appropriations we were putting out, was actually making a difference, a positive difference in people's lives, that we were hitting the target we were aiming at? And there was no real concrete answer. So he handed to me a couple of publications from Pew Charitable Trust. There were reports on Results First. I read them and I thought, this is a framework, it's already there. It's already in place. Other states are using it. We don't need to reinvent the wheel. We can use Results First. This great program that was out there already humming along. All we needed to do was join the ride, basically.
The North Carolina Results First initiative is a project that our office first really got involved in almost 5 years ago. And it's a way that the Office of State Budget and Management can really lead efforts in the state to advance evidence-based policymaking across state agencies and across various divisions within those agencies, and hopefully also in the legislative branch across the street, as we call it here. OSBM has partnered with a few agencies on Results First. We started with our Department of Health and Human Services. We've done a few programs there, and we've also worked with our Department of Public Safety, which is where juvenile justice is housed. Juvenile justice is one of our more recent partners, and they really came to this project with sort of a clear understanding of their questions, which was fantastic for us. I think as juvenile justice looks to continue their work to use evidence-based, research-backed programs, I think that we can see those effects across the full spectrum. So it's better for those justice-involved youth to be put in programs that we know are going to work. It's better for their families, and of course it's better for North Carolinians as we all work to try to keep those justice-involved youth from becoming justice-involved adults.
So in 1999, there were a task force that was put together looking at reform of the juvenile justice system in our state. And it really looked at how do we reduce the number of kids in punitive settings and move them towards a more therapeutic approach. And so for kids that are low risk and have low history points, they would end up in a level 1 disposition. Level 1 dispositions tend to be community-based, things like restorative justice, doing community-based services to amend for their behaviors that they've done. Level 3 in the state of North Carolina are most at risk, most serious offenders in the juvenile justice system, and they end up in our youth development centers. So the level 2 kids are the intermediate kids that are in between those level 1s and level 3s, but they do have typically pretty serious charges that they're facing, and they do have pretty serious risk factors that they're facing. And so things that were studied in this particular Results First study really focused on those level 2 kids. When I first started working in juvenile justice in our youth development centers in the deep end part of our system, we had almost 2,000 kids. Today, we only have 148. We were admitting kids into juvenile detention centers, almost 10,000 admissions a year. Today, that's down to only about 3,000. So some of the results that we saw from the Results First process was that we have programs that reduce recidivism by 55% down to 19%. So that's over a 30% reduction in recidivism. And so for each recidivism event that we prevent in the state of North Carolina, which means them getting back in trouble with the law again, we save the taxpayers of the state of North Carolina over $120,000. That's really tangible. You understand, hey, look, $120,000, that's a lot of money. I often tell people for that same amount of money, I could send that kid to Harvard, right? If we can serve that same kid in a local community and invest those dollars in that child and wraparound services and keeping them out of that deeper end part of the system, then I think that's a well worth it investment for our state and for those kids.
I think the future of evidence-based policymaking in North Carolina is good. I think we've developed these partnerships with the legislature. We have champions there. We have partners throughout the executive branch side. State agencies are understanding more and more what we're talking about when we put out budget requests and say we need to see data and evidence.
It's going to continue to grow because there is value in this program. That's what excites me about it. It took a while to get it going, but we have overcome the original inertia in North Carolina through a variety of people signing on. We've got a lot of good House members see the value in it. The Senate members see the value in it. We've got OSBM and what they're doing with the training, with the evaluation grants, expanding the program in North Carolina. You're going to hear more about North Carolina and Results First in the years ahead. We're not done. We are just getting started.